Good afternoon and welcome to Monday, July 20th, Health and Human Service Committee. I would like to thank everyone for attending today. I do have a few changes to our agenda. I'm going to move the chair's report to underneath the area of our presentations, underneath the child care and school reopening updates. Just to give everyone the heads up, we are going to open this meeting up for some public comment. We have received some feedback and we're in the process of trying to figure out how to allow for public comment on our Zoom meetings. We know that some municipalities have had some difficulties and have been Zoom bombed. So we've been very cautious about who we're letting into these meetings. And this is our guinea pig. So please bear with us as we try and get this right. We do have the professional IT guys on the line to help me out here. But I did want to open the meeting up to public comment. And I see that we have two from the list that had written into the legislature before. And just want to see if either Bill Sonnenstall or Sue Pergolt wanted to add something for public comment today. Sue, can we start with you?
Sure. Well, thank you so much. I had no idea. I'm glad I combed my hair. Carol Bushberg and I wrote a letter to the colleges, to the legislature, to everybody we could think of. I just sent it out to the press. I've gotten some response. We've just updated it to include our pleasure with Ithaca College, having decided not to allow 22 states that have been restricted to have their students come. So we have a lot of concerns. We have a lot of concerns, of course, about the community, about those of us who live in the community and who are not part of Cornell. We have a lot of concerns about our health. As you can see, I'm in that group that could be severely impacted, and so is my husband. So our concerns are that, in fact, Cornell is not taking the steps that they need to take to keep us safe. And I personally, I can't speak for Carol. I personally am not sure that they have it together to do so. So if you'd like, I could actually read out the questions we have. If not, if anybody wants my letter, we could send it. Should I read the questions?
I think that would be helpful. Sure.
Give me a second here just to get back to the letter then. Okay, so the questions we ask are to the colleges, and I can see that the community is stepping up to this, but who will police the wearing of masks? And I just say that being that, you know, I mostly am self-quarantining with my husband. We do Instacart, we don't go into stores, that kind of thing, but on my trips around town, I see numerous groups of people not masked, social distancing, including some construction workers on my block who I have spoken to and called their company. So who's going to police the wearing of masks anywhere in this town? How is that even possible? How, you know, I don't want to turn into somebody who turns people in. That doesn't sit right. So how's that going to happen? And maybe police the wearing of masks isn't the right word. Who's going to monitor the results of the virus testing and notify the community when citizens become ill? Is Cornell, Ithaca College, and TC3 in communication with the health department? Are they going to tell the health department when people get sick and notify us? Where are the facilities for students and the families of students to self-quarantine when a person becomes ill? And so Ithaca College basically somewhat took care of it by not allowing students in from the 22 states. So that's excellent. But what about I know that the Airbnbs are full of families who have come up here, families, to bring their kids to school. You know, are they self-quarantining? Who's monitoring them? They didn't fly in. If they drove in, who's going to know? Will the colleges take financial responsibility for the cost of healthcare and support the community members who become ill? So, that's a really big question, but those people who don't have insurance, who is going to pay for that? And what about the impact upon communities like Auburn, Binghamton, and Watkins Glen, when those who commute from their jobs at the colleges bring the virus back to their hometowns and families? Now, those are just 5 of the questions we put in our letter. There's many, many more questions, but those are 5 that we came up with. If anybody wants to see the whole letter, I'm happy to send it again. And so that's it. I'm feeling very, I don't know what the word is, but anyway, I feel like this has to be addressed. Thank you for including me. And if anybody has any questions for me, great. Otherwise, I will move myself.
Great. Thank you very much, Sue. And I know that all the legislators were on your list. So we have received the email. And whenever Frank gives his report, perhaps he can answer some of those questions for you. Okay, next in our meeting is, I believe it's Dr. Sonnenstahl. Would you like to add for public comment?
Sure. Thank you, Shauna, and thank you for inviting me to today's meeting. I too sent a letter to the legislature, and I did speak with Shauna, and I talked with Rick Johns on a Zoom conference. I did attend the Northeast meeting that Shauna organized. And many of the questions that I sent on to the legislature, are very similar to the ones that Sue raised. I would just add a couple of things that I think need to have some very serious consideration. And I might say that I am now a professor emeriti. I just retired. But since March, I've been on a whole variety of meetings with the Cornell Faculty Senate, the ILR school faculty, town meetings with the provost and president. So I've heard an awful lot about the plan and what is going to happen with the reopening. Just the last week, I was on a Zoom meeting with the Office of Sororities and Fraternity Life. So there's a lot of internal conversation going on about the plan. And let me say that I think the university's done a lot of real hard and good thinking about all the testing that's going to be required. They've done a really, really good job with that. I also teach about social norming. I teach bystander intervention and work a lot with student leaders on campus. So I can also say that I think what the university is trying to do in terms of peer compliance with mask wearing, hand washing, and all of these important things, we can probably get a lot of really good compliance from students, particularly on campus with a lot of that stuff. Where I'm less confident that we're going to get a whole lot of compliance is with parties in College Town. And I think that worries many of us because we've read the stories in Alabama and Washington about what's happening there in terms of fraternity and campus parties becoming super spreader events. And I think that's important to realize. I think in terms of compliance also, the university is setting up a website where community members, those people in College Town, for example, can let the university know when there's a party and their students aren't complying. with the compact. And I encourage everybody to know what that is and to let the university know about it. I've also been very interested in seeing how the campus safety folks and the Ithaca Police and the Sheriff's Department might be responding to parties. I don't hear much initiative and discussion about that. I don't think they need to be banging down doors and cuffing students and any of that sort of stuff. But there should be some protocols in place for how those authorities will be working together and collaborate with one another when there are things like sound noise ordinance violations, or there's violations of occupancy rates and whatnot. So there are a lot of things that are party related that might signal that something's going on, that Cornell students are breaking their compact with the university, and simply one protocol might be for the police to take the names of students who are attending such an event and providing it to the university in terms of their hotline. So there's a whole variety of things. I'm also concerned because I've sat through all of the modeling and thought hard about the modeling. And 2 months ago, when Professor Frazier presented his models about reopening to the Senate, a number of us asked whether, in fact, the modeling took into account, the impact on the larger community in terms of Ithaca residents in Tompkins County. And after a lot of hemming and hawing, he said basically no, that was not part of the equation. I understand now he's finally gone back to take a look and to model that. But when you look at the best case scenarios, we're talking probably in the order of about 1,200 infections on the Cornell campus alone, even with 100% going right in terms of student social distancing and everything that we're supposed to be doing. And so the question becomes, how do those 1,200 cases impact the immediate community around College Town and in terms of the larger community? It only takes one infection. Students all shop at Wegmans. I imagine most of us on this call have families that shop at Wegmans. So if you end up with a super spreader event, even with the best testing, you're going to end up with lots of problems. And I understand that Professor Frazier said it was more likely that the residents of the county would be infecting Cornell students than vice versa. I think that's the wrong response. I think it's an interactive response. We all know in the last few weeks that adults in the community have been out having unsafe parties as well, and that people have been returning from places like Arizona and Texas and Florida, where they've been visiting and infected. So it's an interactive process. And one of the questions I have is how do these events in these cases get handled by Cayuga Medical, the health department, and whatnot? Another question that I've raised at a number of events, because it's clear that Cornell's plan does not seem to have been approved yet by the state or the governor's office, is how does that approval actually work? And I don't know what that approval process is. I don't know what the Tompkins County Health Department's role might be in that. I have no idea. And most of the people that I've asked haven't really said how it works. I know at the Cayuga Heights meeting, Joel Molina, I think, indicated that that it would be approved, but how that process works, I don't know. So my wife and I are retired. We fall into that category. Most of our friends here in the Northeast fall into that category as well. So I think there are a lot of unanswered questions that we need to ask. And let me say, I teach organizational behavior. And Charles Perrault wrote a really wonderful book about 30 years ago called Normal Accidents. And the more complex the system is, you can expect normal accidents to occur. And what we're talking about in terms of the models are very complex models about what to do here. So unless you have 100% all the time in terms of things working out, we're going to have an accident. So that leads to another question I have that Cornell has not seemed to be able to answer, which is what are the metrics that we use to close Cornell down again? That's a very real possibility that everything goes right, but then when you have one of these accidents, what prompts it to close down? What's that process look like? So for me, there's a whole lot of questions. And Shauna, I assume everybody's got access to what I sent you. Please, if they don't, please share it. Okay.
Thank you so much, Doctor. We have, let me just announce some of the panelists that we have today. Lily Talcott, who is the Deputy Superintendent at Ithaca City School District, is here to join us and talk a little bit about what the fall semester looks like for our young people. We're also joined by Sue Del Hall, who is the Director of the Child Development Council. And she is here to talk a little about what our childcare situation is and after school programs. So before we move to that, we do have Frank Krupa, the Director of Public Health. And I think I totally messed up your title. Sorry, Frank. Public Health Director, Public Health Commissioner, something like that.
I answer to whatever you want to call me, Shauna.
Okay. Thanks, Frank. And then we have Jason Molino, who is our county administrator here. And we have been hearing many of the same concerns that Dr. Sonnenstahl as well as Sue have brought to our attention. And I think that there are some answers that both Frank and Jason might be able to provide. So why don't we do a quick update from you guys? And then I know Lily has a time constraint and Sue as well. And we want to get their conversation started so that we can have a robust conversation and get all of the information that we'd like to get from them. So Frank, would you like to start off?
I can. So by way of updates, obviously, since the last time we've met, we have seen some cases develop here in the county. As we've put out in public messaging, many of them are related to individuals traveling into affected states and then returning. We have had connections to a 4th of July gathering. And so, we're really needing our community to continue to heed our recommendations and guidance around social distancing, mask wearing, and our discouragement of travel to those states. I think to answer some of the questions about higher ed, we've been working with higher ed since back in January. Before the closing of those institutions and all the way through. And now over the last few weeks, I think I'm speaking with them multiple times a day to help navigate their questions about how they can successfully reopen. I think the concerns that have been voiced here are certainly valid concerns. We've been fortunate until very recently that we had low incidence of disease here, and any import of large numbers of individuals has a potential to impact that, particularly as we see how the disease is evolving in other parts of the country. I think Cornell in particular has taken great strides to try to address a significant amount of the concerns. Obviously, we're not going to be able to absolutely prevent no import of COVID-19, but I think they've worked hard. And one point that the modeling does show is the number of students that are here and or would return independent of whether classes were held in person or not. And so there is a degree of support for having a robust testing and monitoring system in place because there would likely be large numbers of students here in either scenario. Cornell has a significant testing system that they are planning to implement that will help us to quickly identify any new cases and get them isolated and have any close contacts quarantined. I also believe they have significant plans in place to limit exposures throughout the campus environment in order to limit the number of close contacts that might be created by a case. So those structural and operational plans can help us limit the need for significant contact tracing. To that end, we are partnering with Cornell Health to get their staff trained and familiar with our contact tracing system, so they would be able to support us as we move forward if the need arose. The health department would maintain the initial case investigation as well as the first contact with close contacts. And then Cornell Health would do the daily checks with those individuals to make sure that they are successfully able to quarantine effectively. So I think there's a lot of plans in place. I think there are still some details that are being worked out, and we continue to talk with them and offer guidance and support as they try to implement. We will continue to do that as we go forward. I would offer that we are continually monitoring the status of COVID-19 around the country and how that might impact any decision that we've made to date. All of this is evolving, and every day we're reviewing and talking and trying to make the best decisions possible for our community.
Great, thank you. Are there any questions for Frank? Okay, I don't see any. Jason, do you have a report for us?
In general, just to piggyback off of what Frank was saying, higher ed meetings have been going on regularly for the past several months, or even more frequently now, more on Frank's end than on mine, but still I'm involved with a lot of higher ed conversations around a variety of issues, anywhere from enforcement to testing to communication, working with student leadership on communication. So there's a lot of moving parts to this, and all the questions asked today are all valid questions and good questions. Some we have answers to, some are in some are in development right now with higher ed. But I understand that they understand the value of ensuring a safe return, both for the community and for the students and faculty. And I think they're really trying to do everything they can within their ability to make sure it's a safe environment. So Frank's team and involvement is critically important. And we have been there constantly to work with them and develop those plans into action plans. On another front, we're in the middle of developing the budget right now. I've had several conversations with department heads. This is the second week of department meetings internally. So we have another week and a half of internal meetings, at least for the initial pass, and then we'll have the second round of discussion. So we're busy putting the budget together and trying to understand how to develop a budget with an uncertain future with a lot of unknown variables. Right now, those are probably the only two updates I have for you, unless there's something specific you'd like me to talk about.
I see Henry has a question.
Yes, this goes to Frank or Jason. Do we know the process that doctor mentioned about Cornell being approved, their plan being approved. Do you know how that will work? Also, second question is, I know they were requesting a waiver for the people coming in from the travel advisory states. I assume that waiver was denied, which is why IC has prohibited people coming back from those states.
Frank, do you want to talk about this first, or?
Sure. So working backwards, Henry, yes, my understanding is that Cornell was advocating for some flexibility in the 14-day quarantine from the states. To my knowledge, no such flexibility has been granted to them. And we continue to work with the university and their staff to try to develop plans for implementing the 14-day quarantine for those that might come from those states. So from our perspective, we are in full planning mode to try to figure out how to address that successfully. And I'm sorry, could you tell me the first question again, Henry?
The first question was, in terms of the Cornell submitted its plan to the state, what's the process for approving that plan?
So my understanding is that it goes to the state. I think the state is going to be reviewing them, but I don't know about an actual approval process. I think they will be affirming similarly to other organizations that have had to develop plans and then affirm that those plans exist and are available.
Yeah, my understanding of it is that they have to affirm, similar to guidance for other businesses or entities that could reopen, they have to affirm that they've met the guidelines outlined for reopening.
I assume that there's been no changes in any of those plans, that all those plans are just affirmed.
I know their plans were, a lot of their planning documents were posted. It was a short read of a few hundred pages. I know that. I know they're up. I'm sure as they're updating it, they're updating all the voluminous amounts of information they have online. And I know that's what they're building off of right now.
Okay.
Deborah?
Yes, thank you. Thanks, Shauna. I wanted to pick up on some of the comments that Sue Progut and Dr. Sonnenstall raised. I've said this before, but I think to some extent, our residents have unrealistic expectations of what the county can do in terms of policing on campus or telling any of our educational institutions that they can't reopen or have to shut down again. I would like to see a legal opinion on just exactly what we are allowed to do and what we're not. I think that that would allow us and our residents to direct our questions to people who can actually answer them with some authority. I agree with Dr. Sonnenstall's concern that we need to have protocols for those off-campus parties and maybe for the on-campus parties too. And that's something that's going to have to be worked out, I gather, with Cornell and IC department and the county sheriff. But most of the concerns that I've heard raised by constituents have to do with those parties. As for people walking around downtown and in various parts of the city without masks, I see as many older people who should know better as I see young student-aged people who also should know better. And I don't know that anybody has the wherewithal to be in the mask policing business. We certainly don't. And then finally, I agree that there should be some metric that triggers a serious reconsideration of whether our colleges and universities should be open. I don't know on whose shoulders that responsibility lies. Again, I think it's probably a joint effort. Thank you.
If I could just, Shauna, speak to a few things of Deborah, and I'll let Frank pick up. I think, Deborah, the latter part of what you just said is the joint effort and collaborative effort on all of this is critically important. So the metric question, I don't have an answer for that. I don't know if there is one, but it's a good question. The piece about the enforcement of masks and the gatherings, which is, I think, the greatest, one of the bigger public concerns that I've received comments on and questions about. It's a good one, and it's important because it could be a high risk circumstances. Cornell has talked a little bit about some of the steps they're putting in place, which would be to ensure that they have follow-up with tenants and residents of those locations, which is an after process, which is important, as well as a compact, I think they're calling it, with students, which I don't think all details have been released to the public, but I know we've encouraged that when they do identify what that compact is and what those consequences can be, it would be important to share that with the public as well, to understand how they're going to hold folks accountable for behavior and activity. So those I know are in the works. We have had recent meetings with law enforcement. We have recent meetings with higher ed, as well as our environmental health folks, to talk about what are the steps and how are we going to respond to those situations in which we receive phone calls, whether it's through patrons and businesses that aren't complying with the mask requirement, or whether it's large gatherings. We have been doing enforcement all along. I will tell you that we have not been responding to every phone call we get about, I saw these two people walking down the street without a mask. We're not going to do that. We haven't done that, and it's impossible to do that. This is where that personal responsibility piece falls into play. So how we respond and how we coordinate that response to the larger gatherings is something that has been discussed over the past few weeks, will continue to be worked out formality-wise as to how the calls are received, how they're dispatched or addressed, what's the immediate follow-up, and then what's the follow-up after the fact to ensure that there's an accountability mechanism. And higher ed's fully engaged in that, as is environmental health, as is law enforcement. So that is an active conversation. I will speak to, student leadership has also been involved with the accountability discussions, as well as with what the compact means to their students. So that's where, you've got all of these different pieces that are coming together right now. There aren't set plans in final stages yet in terms of what that compact is and how they're going to implement it. But I'm hoping in the next week or two or so, higher ed will be able to talk a little bit more about that, because I think that's a good question of what's that accountability mechanism. At the same point in time, balls are in the air and they're in motion with our enforcement mechanism through environmental health, law enforcement, and higher ed follow-up to ensure that there is a good ability to be able to follow up on those types of calls. At the same point in time, there has to be personal responsibility for all parties involved. As Frank said, a lot of the case uptick right now has been related to some 4th of July gatherings. Again, speaks to the vulnerability of those types of situations, and ensuring folks are continuing the mask covering or the face coverings, the distancing, and the good hygiene. So, only thing I can say, and Frank, you can follow up if you want. We're actively aware that this is a major issue, major concern. We've received a lot of comments, questions on it. We're in constant dialogue with higher ed and the parties to be that will help with the enforcement mechanism, as we have for the past several months. Enforcement is not a new thing. We've been working with enforcement over the past several months. Now that we have the potential of students reopening, there is more probability or chances or situations where enforcement will be pressed or stressed. So we're trying to figure out how we're going to respond to that accordingly. But to your point being, it's a very collaborative effort. There isn't one entity that can assume sole responsibility, from the individual to the enforcement agency itself.
Great, thank you, Jason. Anything to add, Frank?
I don't. Jason covered it well.
Great, thank you so much. Okay, now on for our presentation. You know what? I'm sorry. Why don't we go ahead and do a resolution? I know Amanda has to leave soon, and I want to make sure that we get this resolution passed. I have a resolution for the budget adjustment for one-time increase in state funding for the extended in-home services for the elderly program, ID 9444. If I could have a mover, moved by Amanda, seconded by Deborah Dawson. And Lisa, can you give us a little background on this?
Sure. So this is was something that was a supplemental allocation that was issued a little bit late, the end of the state fiscal year in March. When we were doing our state claim in April, we realized that this funding was there, and they are allowing us this year to carry that over to 2021, which is not typical. Usually at the end, if there's any money, they take it back. So it's a good thing.
Okay, are there any questions for Lisa Monroe? I see none. And we're just going to do a roll call here. All those in favor, Deborah Dawson,
Yes.
Amanda Champion,
Yes.
Dan Klein,
Yes.
Glenn Morey.
Yes.
Okay, that's unanimous. Thank you very much, Lisa. Appreciate that. And now for our presentation. Lily Talcott is here from Ithaca City School District. Thank you very much, Lily, for joining us today. I've known Lily for many years. She was the principal at Northeast for many years and took very good care of my children. So I'm very glad to have you as part of our panel. And we also have Sue Del Hall, who is the director at the Child Development Council, here to talk about daycare. So why don't we talk to Lily first? I know that she has another meeting at 2. So we're going to try and gather all the information that we need from her and ask her questions about the reopening of the schools in the fall time.
Great, thank you. Thanks so much for inviting me here. And it's great to see you, Shauna. You run a really lovely person-centered meeting. So thank you for that. It's great to be here. So folks, as you know, Ithaca City School District, we closed our physical buildings on March 13th. And statewide, Cuomo indicated that all of us must close by March 18th. Shortly thereafter, we began planning for reopening, right? Because it was in 2-week increments, we had to begin to wrap our heads around this idea of coming back to physical spaces very early on. So we've been engaged, of course, in extensive research, really gathering and utilizing stakeholder feedback throughout. So students have been communicating with us, of course, staff internally, families, community members as well, through formal and informal methods. And then last Monday, so a week ago, Governor Cuomo held a press conference, I'm sure you all know, and indicated that schools in New York State would reopen if the region was in phase 4. So if our region is in phase 4 and our daily infection rate is below 5% over a 14-day period, we could bring as many students back as possible to our physical spaces, right? So that is clearly our goal. And, we've been working for months to, of course, figure that out. And then Thursday afternoon, we received a 145-page document from the New York State Department of Education, which outlines all regulations associated with that both physical reopening, remote learning opportunities, and what's called a hybrid, right? A combination of both simultaneously. So obviously we have been pouring through that guidance and really taking a ton of information, right? And really synthesizing it to match the planning that we have been doing all along. And this guidance really outlines, really outlines a number of areas, as I'm sure you can imagine, everything from transportation to social emotional well-being, which is wonderful. There's a great section there. Obviously something that we've been focused on quite a bit as well. Child nutrition, facilities, how we will handle things like attendance, technology, and connectivity, right? So it's an extraordinarily comprehensive document, and it really aligns well with the planning that we've been doing. So as of now, here's where we are. We are, of course, in the throes of synthesizing this document, engaging with stakeholders, meetings like this, other meetings, from the Equity, Inclusion, Leadership Council, our PTA Council, right, our Superintendent Student Advisory Council. We're working very, very closely and incredibly collaboratively with our union leadership as well, right? So we have our Ithaca Teachers Association, our Education Support Professionals Employees Association, our Principals and Directors Association as well, in order to come up with the best and most comprehensive way to bring, again, as many kids back as possible to our physical spaces, while also meeting the needs of the adults in our spaces, right? Some of the things that are big, of course, in our planning are things like physical distancing, otherwise known as social distancing, right? So students on buses, as the NYSED document and the Department of Health have indicated right now, must be 6 feet apart and also wear masks simultaneously. So that obviously really challenges a lot of our planning and planning throughout, obviously, our whole state. In terms of transportation, as you probably well know, there has been a nationwide shortage of bus drivers. And so that obviously is an infrastructure challenge, a real infrastructure challenge for us, right? And our community has asked how they can help. And this might be one of those areas, that we really are calling on Ithaca to really help us with. Some of the other things that are pretty big, are obviously things like physical distancing then within classrooms. Although the guidance indicated that students need to both wear masks and be 6 feet apart within classrooms, late Friday night, there was an additional FAQ document that came out from the state education department that was a lot more child-centered and child-focused, that talked about physical distancing or mask wearing or physical barriers, right? So as long as we can maintain that 6 foot of distance, that we can give our kids mask breaks while having them be 6 feet apart. So those are certainly some of the big ones that have come up here. And those frankly are some of the things that really drive a lot of the planning, right? So in what ways are we ensuring equitable transportation for our young people? And in what ways are we ensuring equitable access then to the physical spaces as well? So I can tell you soon, we're obviously, we met today with our teachers union folks and collaborated further. We're collaborating further tomorrow. Obviously engaging the stakeholders. We did a very comprehensive survey as well in June for our staff, our families, and our 6th through 12th grade students to fill out, to really understand where folks are, what their experiences were during the physical campus closure, and what they're looking ahead to, everything from health and safety to social and emotional well-being to academic experiences, to preferred modes of communication, et cetera. So we anticipate having more information out to our community soon. Obviously, we want to work with all of these stakeholders prior to saying this is absolutely 100% what we're doing. But again, we're really working hard to ensure that we can safely bring back as many students as possible as per the guidance.
Great. Thank you so much. I know that there are some questions, and I just had a quick question because I know what we're seeing across the board is that there's so many different things that we have to do now since COVID has hit our area, and we're not getting any funding to do all of these things that are really expensive, like hiring more bus drivers, building more space, masks, hand sanitizer, cleaning supplies. And I know that there have been many discussions with the state. Do you guys foresee receiving more funding in order to do all of these great things that are required?
Shauna, one of the reasons I think you're so great, thank you for starting with that. Of course, we all hope so. The CARES Act funding was interesting, I would say, in terms of how it impacted New York State schools. So obviously, New York State, we frankly still have yet to receive the actual dollars, but the intention is that New York State received the funding and then held our state aid, our foundation aid flat to our school district, right? And then backfilled it to an extent from that CARES Act funding. So obviously folks talk about the intention of the CARES Act to really fund those additional expenses associated with things like mask wearing and buses, et cetera. And instead, for us, much of it's going toward daily operations. However, our board has been, I think, very wisely clear that we have reserve funds for a reason, right? They're for a rainy day. It is pouring outside. Yeah. So our board has indicated that we'll be utilizing those funds. They don't come back, right? It's a savings account. So we have to be really cognizant of that.
And that's where we are too as a county, and,
right.
and talking about our rainy day fund. And we've done a really great job and been very conservative on how we spend money, and we're there too. So let's see here. There are questions from Deborah and then Amanda.
Yeah, thank you. Thanks, Lily. I appreciate all the hard work you're doing, and I certainly don't envy you to pour through 147 pages of state regulations. You said a number of times that you're working towards bringing as many students back as possible. So I gather this isn't going to be a binary, everybody's back or everybody isn't. Are you making exceptions for distance learning for kids with comorbidities and kids from families with members who have comorbidities that make them more susceptible?
Yes, absolutely. And the guidance is very clear that we must do that. And that's always been a part of our planning, just knowing, even when the CDC released their steps back in, I think that was April, they indicated that even with step 3, with a full return, there would still be exceptions for those within vulnerable populations, those folks who, the CDC is very clear about who those folks are. But then within the guidance that was just released, there's information about those who also have family members at home who may be at high risk as well.
Okay, so they'll be able to Zoom in.
Right. Yes. So that is certainly, part of the state guidance, and thank goodness we've been preparing for this, is really that we must come up with 3 different options: in-person learning, remote learning, and hybrid learning, this idea of both.
Thank you.
Yeah, thank you.
Amanda?
I had sort of a similar question, but thank you so much, Lily, for it. I just can't even imagine all the things that you're trying to figure out. And, just what you said about the buses themselves, my son rode the bus throughout elementary school, and it was known as the rough route, and they didn't have another adult on the bus. So it was just the bus driver, trying to handle a lot of rowdy kids. And so I guess, that's just a little anecdote, but I'm assuming you'll have to have other adults on the bus to maintain the physical distancing and make sure kids aren't taking their masks off. And anyway, I also don't envy everything that you're trying to figure out. I trust that, all the groups talking together and the stakeholders will figure as much out as possible. But my sort of follow-up question is, there's a lot of parents that I hear from who don't want to send their kids back, whether they have health issues or not, and I might be one of those parents. I guess, is the hybrid model, and maybe you can't really answer this yet, but is it being talked about that kids could be there some of the time, or some kids go on Monday and Tuesday, some kids go on Wednesday and Thursday. I don't know if there's anything about that you can say, but I know there's a lot of concerns.
Absolutely. Yes. And there's, frankly, we have put it all out on the table. So just to clarify, again, in the DOH guidance that came out on Monday, it did indicate that those within vulnerable populations and also those families who don't feel comfortable sending their children can keep them home and receive remote options. So of course that's we're certainly trying to accommodate that as well. I did fail to mention, I should have mentioned this too, just because I think it's important within the conversation, both as we create reopening plans, we also of course create reclosing plans, right? We will likely be in a situation again. And I should have mentioned the metrics associated with determining that. So the statewide metrics are that if our region experiences a 9% daily infection rate over an average of 7 days after August 1st, right? Did you catch all that? Right, so it's after August 1st, right? 7-day average equals 9% or higher infection rate that schools in that region will need to shutter and provide solely remote learning options. So all the preparation that we do, of course, for the students who may remain home for any number of reasons, of course, then serves all students well when we're in that situation. Additionally, prior to receiving this guidance last week, there was guidance that any single case of COVID-19 within a school community, so staff or student, right, who tests positive for COVID-19, that school would need to close for a minimum of 24 hours. New guidance has come out that indicates a couple of things that are contrary to that. One, if we're adhering to cohorting, this idea of keeping groups of students together, the same group of students together as much as possible and limiting mingling with other cohorts of children, right? So if we're doing our due diligence, a school is doing their due diligence and doing that well, that instead, you can work with your local health department, and Frank and I were just talking about this morning, to establish the protocol to simply send that cohort and the staff that work with them to the remote setting instead. So obviously we're finalizing those protocols. Those will be a part of our reopening plan as well, because that's required. By the way, it's due in 11 days by midnight. So, you know, we're not going to sleep. We haven't been sleeping, as I'm sure you can imagine, our whole team, all weekend. Beautiful weekend to work on a computer, I'm sure you can imagine, right? But obviously we want to be as thoughtful and just really as careful as possible when there is a positive case within our community, right? Of course, the research is really emerging around how the virus is spread. You know, big article this weekend. I'm sure many of you saw from the New York Times. Of course, we engage in extensive research. We've begun a higher education advisory council as well. So we communicate with folks there, have communicated with epidemiologists at Cornell, et cetera, as well to try to stay as up to date as possible. I'm sorry, I probably gave you a lot more than you wanted there, Amanda. My apologies.
That's great. Thank you.
Yeah, thank you.
Okay, two more hands are up, Henry Granison and then Dan Klein.
Yes, thank you for your words. I just had two questions. One, I assume you don't have the physical space to have everyone return at the same time. And second question is, when you talked about the metrics, is that district-wide or is that section-wide in terms of like the Southern Tier section, or is that just a district?
Right. I'll start with the second one first. So those metrics are statewide, and it has to do with your actual region, right? So I'm sorry, those are determined by the state affecting your region. So we're in the Southern tier. Right. I mean, we're in this really interesting place, right? Because we border all of these other regions, which is cool. I live in the Finger Lakes region, for example, right? But work here. And it's just a hop, skip, and a jump away. And then your other question, let's see, we have over 1 million square feet of physical space in our school district. So believe it, I mean, we have an enormous amount of space. And within the guidance, it's very clear you can be outdoors as much as possible and engage students in learning outdoors. There's even very strict regulations about the use of tents as well. I think we're exploring many options. However, we know that from our preliminary data that we collected in June, there are a number of families who, even in June, when community spread was extraordinarily low, absolutely would not send their children. Hence the language, bring as many students back as possible, and frankly, who want to, right? With a clear understanding that that will not work for a number of families.
Great, thank you. Dan Klein.
Yeah, you talked about remote options for students. Might there be remote options for teachers who are vulnerable?
We are, of course, going to continue to comply with ADA and FMLA requirements, of course. So folks just submit those through our Human Resources Department as always. So absolutely, we do our best to make accommodations in pre-COVID-19, the pre-COVID-19 era. And there are obviously some different opportunities for teachers specifically in this new era as well. So there will certainly need to be a level of choice for our teachers as well.
Thank you.
Great. I think that's all of the questions that I see. I don't see any other hands. Thank you again so much for joining us. And I know that we always talk about how we're building the plane as it's up in the air, and it certainly sounds like ICSD and the other districts are no different. We wish you the best of luck, and try and get some sleep.
Thank you. Right back at you all. Thank you so much for inviting me along. Really, really appreciate it. And feel free to email me if other questions come up.
Thank you, Lily. Take care.
Good to see everyone. Thanks. Bye-bye.
Hi there, Sue. How you doing?
I'm fine, thank you.
Good.
Keeping cool.
That's good.
That's a lie, but it's kind of a lie, but I'm pretending, so it works for me. Hope it works for you too.
Yes. Yes.
I closed my window here next to me because the woodpeckers and the bees that go zzz right at they won't be able to hear anything. And I'm not turning off the fan, so
much for nature.
Right.
Okay, so I think the big topic that we are all thinking about is, what are we going to do with our kids, and how are people going to go back to work? And I mean, childcare is so essential for our community and our economy, and we're glad to have you with us to share your opinion on what you're seeing and what's going on in our community with childcare.
Thanks. There's some things I know and some things I don't know yet. So I appreciate the opportunity. I'm just going to start by saying what we're working towards is the deficit position we were in before COVID. So if we move childcare along to a certain place, we still have a lot of work left to do if we want it to help support our community and our economy and our parents. I'm glad to be here on Education Day because I think early childhood education kind of gets forgotten and not recognized as the importance that it has. But I am going to talk about both preschool and school age a little bit, because I think that school ages, I won't have a lot to tell you yet because of what Lily just told us, all of us. We've been in communication and it's certainly a challenge. So let me just start with where we are in terms of capacity. And the very first thing I want to say is that clearly the research was saying that if a program closed for more than 2-3 weeks, there was a very high likelihood that they were never going to open again. And in our community, we can be very proud of the fact that local foundations really stepped up to help so that we had operational relief for some programs. We had scholarships for parents. We distributed $75,000 in scholarship funding. So we don't have the closure rate that was happening nationally. Where we are now, though, is looking on a preschool level of trying to see how many children how many of those programs are back to full. We're at almost 80% overall, a little bit less with the home-based care, which is taking its time. They're either open or not. These childcare centers are taking some children and then they're slowly adding them in. So we're moving up the ladder in terms of capacity. The guidelines that first came out told us that we would have to limit children to no more than 10 in a group. And a week later, that changed to 15. And so the childcare programs the centers were ecstatic because it made a better financial model. From a public health perspective, it might be another question because they do have to try as best they can to keep those children separate. That's nearly impossible. So we're looking at some of the childcare centers particularly are holding spots for families to return in the fall. So they're not necessarily, they have waiting lists, but they're not full. They're waiting for some of their families to come back, and then they're taking the names of other people who might be interested in care. So we're just about right up there now as to our pre-COVID levels for preschool care.
So Sue, are you actually hearing, and one of my friends mentions this the other day, that if people are still at home working, that they're having to pay for their spot even though they're not using it to reserve their spot? Is that?
In some situations, that's an individual, they're all small businesses. They set whatever plan they put in. And if some of them have said, if you want your space to be held, then you have to pay. Otherwise, and some of them are just keeping their deposit in. So sort of a security amount. So it really varies. There's not a lot of them that are asking for regular ongoing pay. They've all maintained contact with those families, but certainly it's not the same as paying for childcare. I do want to talk about how people pay for childcare and a little bit about that. But I'm going to jump to going on a school age capacity because I think this is you may have known, certainly when summertime was coming around and school was no longer in session, parents were very, very concerned about the availability of summer care. And the guidelines came out and opened up a little bit of space, and a few programs opened up, not very many, but they're not full. And so we know that issue on parents, I think Amanda was mentioning it before, about concern of what it means to have your child back in a group session. They told us they wanted it, but in reality, when it came down to it, they weren't sure that that's really where they wanted to put their children. So I think that we're going to see a lot of waffling going on and not real clear guidance on supply and demand and how well it really is meeting the need. You're going to have to give me a moment to try to figure that one out as time goes on. So we're expecting that school age care, we have absolutely no idea what the need will be. Our experience is that when people didn't have to pay for care, that they sometimes chose to suffer it out. It's difficult to try to work and care for your children at the same time and educate your children at the same time. But the cost is enough to sort of sway some families. If I'm going to be home, my child's going to be home, I'm going to save that expense. So we see a little bit of both sides of that question, Shauna, about payment and where that comes. So with school age childcare,
If I had the chance, I would pay $1 million a month to get my son into childcare.
Yeah, I get you. Mine are in their 30s now, but I was there at some point in time. Yeah. So that always starts with, if I had a chance, right? If I could afford to do that. So school age childcare, we know right now that all the schools are making their decisions, and the after school programs are made up in a lot of different. So we have about 6 programs that are in the community, and they're run by nonprofits. That would be like GX, Southside, Varna Community Center. There's a church that has, Trinity Lutheran, that has programs. So those programs will probably be up at a modified level, and some of them are already open. Y is open for the summer, for example. The ones that are operated in school come in 2 forms. They're either operated by the school, who assumes liability for that program being there and usually pay some of the expenses. And those are not regulated by New York State. And then there's parent-run programs that operate in the schools, Ithaca City School District being the largest district that has that set up. And they have to be regulated as a school-age childcare program. So they are there at the school grants them the opportunity to be there and be on their space because it's mutually beneficial as nonprofit organizations. But right now they're waiting to see, I think it was Henry that asked the question, what about space? What's going to happen with after school programs, which typically are established in the cafeterias or the gyms and the outdoor areas. So lots of kids in one area. That would mean if we wanted to have after school, we have to create separation of groups of 15 right now as it stands today. Rules change all the time. So we won't be able to accommodate the same number of children. And we're looking at what kind of alternatives in the community spaces, not just the community centers, but maybe other spaces that could be used. We're trying to problem solve around that. It's just really difficult because we don't know what the need is. And the expense to start up a new program and get the staffing on board is pretty significant. So we don't want to build something that no one comes to. So we're sort of in a real, just in a state of flux right now, and parents are starting to panic a little bit. There's a lot of letters flying around. We are in communication with the school districts. Three of them in particular right now we've had close communication with, and the others are ones that operate after school on their own. And you can imagine we were sort of thinking of all the different scenarios, like, they could be there for a half a day, or they could and need care for half a day, or they could be there totally online, but need someone else. They want after school program during the day, which would really be a out of school, in school program, which can happen, but is a different model. So there's a lot left to be determined, and I don't have any answers. Until Lily gives me some answers, I don't really have any answers. And then I might not even then, but so capacity for the preschoolers going pretty well, school age, not so much. The financing issues, we really have to keep an eye on this. So in the school age, for example, if we were to pay for a half day of care as opposed to the 2.5 hours of care, 3 hours of care, the cost is going to go up to parents. And that's a cost that hasn't been factored in. And they're already in a time where many parents aren't making the wage, had already spent their own rainy day funds if they had them, and are now, they don't have the wages to pay for additional school age childcare, which is much less than childcare. So I'll say it's much less. If it was full-time, it's not much less, it's the same. So we're talking about, if you had full-time care for kids, it would be $34 million. It's a lot of money for 40 weeks of after or all day school. It's pretty hefty at half day. So I think that we have to think as a community, how are we going to support parents? I mentioned earlier that we had $75,000 that we gave out in scholarships for parents, and that was all for parents who fell under the category of essential personnel. We haven't been able to help parents. We have a small fund of less than $10,000 that we can draw from for the general community needs as it comes up. But I think this is going to rise to the top as a big issue. That parents already have trouble paying the $250 a week or up at cost. So I think that's something we have to monitor, and we'll have to monitor what's happening in the childcare community is that the spots that are full are the full-time slots. And we have the part-time slots are still yet to be filled in. I thought it would be the other way around, but that's the case. So, so we're just trying to navigate through some of the changes. It feels like it's a little bit different. I would say that two things that really stand out is one, childcare is really for a sort of privileged class. We talked about the cost. And so kids who are disenfranchised from regulated childcare are probably disenfranchised in many other ways in the community and vulnerable, and we worry about them. We at the Child Development Council do have connections with the ways that their care might happen, but it's not consistent, it's not always stable, and it's not always good. It can be, but it's not always. So that's an area that I really think as a community we need to pay attention to and try to figure out what is happening with children. And this expands the age range. And then the other thing is that these are a lot of small businesses, micro enterprises, and they don't have anybody to call when there's a healthcare question. Maybe Frank wants to, I've given out the health department's phone number, but the big question is, do I have to exclude them from care? When do I have to make those decisions? It's a really tough position when they're not medical people. I'm not a medical person. I'm not going to give them medical advice. But there's questions like, okay, so I had a child that I sent home. The doctor didn't get a COVID test, but the child has to stay home. But I'm still not really sure about that. Then they have a sibling in care. So does that one not have to come home? Because under our old policies, they didn't. But under the new policies, they maybe should. So they're really, I think this is more of a statewide issue. I also hand out the New York State hotline number, but I think that early care and education needs to have its own sort of hotline, and they need to know, they have someone that can provide them some guidance, like they do with Child Protective Services. There's a statewide hotline, a statewide place where they can call and report or ask questions. Well, this is a situation where the child care programs need that advice. They need to have that. I think we need to consider how that can happen.
Great. Thank you, Sue. Are there any questions? Oh, Amanda Champion.
Well, not really a question. I just, again, want to say, like, you're doing amazing things, and I just can't even imagine all the things that you have to figure out. And I just really appreciate the thinking and your organization and the folks who are working on this. I guess, you're talking about a hotline for people to call. Like, I don't know, does anybody, like, how do we make that happen for folks? I mean, obviously they can call the health department for specific questions, but I don't know. I mean, I think it sounds like a great idea. So there's answers for people. But
Is this something we can roll into 211 maybe, Sue?
Possibly.
Yeah.
Possibly. Mm-hmm. And that operates at a larger level than just within Tompkins County too.
Right.
Yeah, Amanda, and I'll speak a little bit to that later in my report, but I had a conversation last week with Kathy and John from 211 and Human Services Coalition last week to talk about that and just sort of look at the calls that they had received from March through June and really kind of look at what people were calling about. And I'll get into more of that, but that is something that is on the conversation docket, and we're talking about it. So
great. That's great. Thank you.
I want to add one other thing, is that I've been thinking about some of the systemic changes that happen that might be important to keep track of that are good. So for example, we've had a collaboration with Ithaca City School District all spring long to help deliver food. So we've been providing baby supplies to families, and many of those families also have school-age children. The buses were going out and making deliveries and making sure that they had food. If that continues this fall, which I would likely see that it will, that's a collaboration that I think we want to try to sustain as well as we can, because families aren't, it's the whole family we want to try to support. And so, more power to them. Thank you very much for getting that to us. It took work on both ends to make it happen, but it was really good. So there are other things I think in our community that we need as a broader community to start to capture and make sure we document and think about where we go forward with that.
Lisa, Monroe?
Yes, I just wanted to add to that. Thank you, Sue, for saying that. And as part of our Center for Excellence work that we've been doing, we have some interns from Cornell that are working on just that, capturing the best practices and whatnot from not just age-friendly best practices, but that focus on COVID best practices and collaborations that happened in the community. So we are documenting that. And if you haven't been in touch with one of those interns, I'm sure you will be now. so they're doing interviews with people to kind of pick their brains to figure out, what was done, how it was done, and what was successful and what wasn't. So yeah, that is a great point.
I did talk with one on transportation and one on food, but I don't know, it might be worth coming back around to at some point, because thanks, that's great. I think that's wonderful.
That's great. I have also seen, Sue, you guys setting up at the food bank at TC3 with diapers and formula. And this was something that very early, whenever COVID first hit, like the first few weeks in March, I kept getting emails about running out of diapers and running out of formula. And these seem like no-brainers, right? Like, in order to take care of babies, you have to feed them. But people weren't getting enough WIC checks. They were running out, and you guys just really filled in the gap. And just seeing your staff really take this just so seriously and know that this is essential. I really do appreciate that. You guys are wonderful. So thank you.
And somebody in Ithaca is delivering on their bicycle. I think that's awesome. So we get home deliveries, and Gadabout has also been helpful. So it's been pretty amazing to see the community rally around that and provide the financial support to make it happen. And staff been, of course, I got great folks working with me. They make me look good.
That's good. Okay, I see no other questions for Sue. Thank you, Sue, for joining us today. I'm sure we'll be checking in more as the fall semester opens up and things change. We'd love to keep having updates from you.
Great. Happy to be here.
Great. Thank you.
Thank you.
Okay, next in our agenda, I have the chair's report, and mine is going to be pretty short and simple today. As we continue to navigate through COVID, I think one of the most important things we can do is just communicate. And, really from the beginning, what we heard very early on is wear your mask, social distance, don't go into large groups if you don't have to. Like, these are things that we learned back in March. And what we're seeing, with the July 4th parties happening, with us having, at one point 25, 30 positives at one time in a five-day period, we need to go back to doing those things. And we need to, not let our guard down, because, it's up to all of us. We can't blame it on the college students. These positives are us doing things that we felt like we've been safe from. And so I encourage all of us to just keep the messaging out, and to really, I think Deborah put it best. And, a lot of the students, we're starting to see them. I drove through College Town and I see license plates from everywhere. Students are unpacking. And we really are a collective community. And, even more so, we have to realize that Ithaca was really founded, the whole idea behind us being like a center for academic excellence, like the students, the people that work at our universities, they're the ones that feed our economy and that make Ithaca what it is. So I ask all of us to do our part as local leaders here on this call, and lead by example. Also, I wanted to update. I do see that Reverend Ken Clark is here too, but just give a quick update on the Human Rights Commission. They have presented a statement. It's a very good statement. However, we're going to bring a few more people into that. And in our next meeting, we are inviting Kit from DSS, as well as the sheriff and Ithaca Police Department Chief Nair to come in and talk a little bit about that statement. with the whole idea that everyone can kind of get on the same page and be on board, and it could be a collaborative project. Also, if I could let all of you know that we do have an opening for a human rights commissioner. It is, I believe, a one-year term. So if you know anyone in your community that would like to be on the commission, please have them look at our county website, and there are applications that they can fill out online and send over to Kathy Covert. And that is my chair's report. Let's go to, Amanda's still with us. Why don't we do the minutes approval from June 15th, 2020, if I could have a mover. Moved by Dan, seconded by Amanda, and we'll just do a quick roll call. Amanda?
Yes.
Oh, I'm sorry. Was there any discussion on those minutes?
No.
Okay, I see no from everyone. Amanda said yes. Dan?
Yes.
Glenn Morey?
Yes.
And Deborah Dawson?
Yes.
And I am a yes too. That's unanimous. Thank you. And if we could just, let's move over to departmental updates. And I will just go through my list here. Frank, you already gave your department update. JR, would you like to give a department update for Veteran Services?
Sure, I can do that. Well, like everyone else, our doors are still closed, but the office remains in operation for people providing service via phone or virtual means. I've done my underway for preparations for my first full budget cycle. I've submitted my budget with the scenarios and have my meeting scheduled with admin actually this week. I believe I told you last month that I have achieved my accreditation through the American Legion, which is a big yay for that. And also this month, I completed the course that's a core requirement for obtaining training both through New York State, accreditation through New York State, as well as a process that will provide me access to various records through the VA. And actually just got an email during this for signing up with another system that was part of achieving that class. So hopefully within a couple of months, I'll be full steam underway. And actually at the end of this month, we have a week-long session through the state's Division of Veteran Services that's focused on county veteran service accreditation. Our two events that my office sponsors, the Veterans Coffee House with Team RWB, as well as the Warrior Riders with Warrior Riders in Ithaca. Those still are active, and we've been meeting pretty much twice monthly online, and that's been working pretty well with everyone. And next month, actually early next month, we have a class called Mental Health First Aid for Veterans. This is something we tried last year. I didn't make it, but this year the class is actually full. Trying to stay with COVID requirements. It is, Beth has limited to 10 participants, and it's full. And that's going to be in early August. And we're co-sponsoring that along with COFA.
Great. Thank you, JR. And congratulations on your accreditations.
Thank you.
Any questions for JR? Okay, I don't see anyone. Thank you very much. Kate Shanks Booth, would you like to give an update for youth services?
Yes, if I can unmute myself. There we go.
Okay.
Yeah, so Sue did a really good job of just kind of painting sort of the picture for what the youth programs are doing. There's a lot of unknowns. So one of the ways that we as a county have been trying to provide some oversight and make sure that the clearinghouse information was through the 2020 youth programming task force. So there's been a couple of really cool things sort of come out of that. Exploring the waterfront is I believe they have gotten the corporate sponsorships that they're looking for, but this is a collaboration between the Ithaca Children's Garden and some other local providers in town that are going to be doing a family. So a parent and a youth will go and explore different parts of the waterfront. It's a 4-week program, I believe is what they're looking at. So we were able to get in touch with TCAT with the opening of the Alex Haley Pool, and Route 22 is going to be doing some pop-ups. They typically do that anyway, but with closing of Cass and Stewart Park, They weren't sure what that was going to look like. And so they're going to be running some program buses that are going to be free to the public around past the Explore the Waterfront and all the way out to Teganic a few times a day. And so they're going to be looking at that on a 2-week basis to see what the rider capacity is. It's a free program, but they're asking parents to sign up so they make sure they're within capacity of all the regulations that they're having to do. So that's kind of cool. And then the other thing that really has come out of that is really this clearinghouse of information. I had mentioned that I talked to Kathy and John from Human Services Coalition last week, and just a couple of things that have come out is that there's not really a uniform place to get information for those providers who do youth care. And so we're looking at setting up some sort of platform to share best practices. So if they have to do a safety plan, maybe somebody has one that they've done, so they put out, so we're not having to recreate the wheel. If there are virtual trainings that are coming out to help with some of this stuff. And so just a way to fast track information for the providers. Doesn't really, parts of it exist. The school age has a different listserv. There's different listservs for the younger kids. The rec directors have their own listserv. There's not one place for people to go if they touch kids' lives, which even now to kind of find out what's going on. And so we do have our camp guide that we do, but really we're running right now to the same information that 211 is. We put that out, but it's only as good as the information we get back from the providers, right? And so we're trying to figure out, is there a better way to do that? And so John was just sort of looking, John Mazzella was just sort of looking, just eyeballing the information that he had in front of him last Friday. And there's been about 4,800 calls that have come into 211s from March to June. Most of those had to do with education questions about the schools, how they're operating. A lot of that had to do with nutrition and food insecurities. Only about 250 calls came in looking for programming or childcare. And we don't really know in depth what that means. One of the things that we do also anticipate that caused that was that the daycare council is sort of the resource, right? Everyone calls the daycare council. And so one of the things that John had said to me was that he had actually had a conversation with the daycare council about creating some sort of platform where information could be contained as well. So seems like the idea is bubbling up, and hopefully as soon as we get some more information from what the schools are doing, whether the school-age programs are going to be allowed, what that looks like, we'll be able to hopefully find a way to get some up-to-date information in a more concise, centralized location. That's the idea. There's also been some talk about the need to refocus on the local broadband. We've kind of mentioned this. We have people who live in rural areas who don't have access to it. We have some kiddos that live in the more urban areas that don't have access to it for different reasons, right? And so if we're going to continue to be a society that's going to continue to move out and need more of that online access for working and for distance education, how to best go around that. So there's been some talk about how to maybe form that and bring that up and bring the people to the table that we need to bring some change in on that. Like I said, Sue did a really good job. Most of the camps right now that we're finding, there was sort of what parents said they wanted and what they're comfortable with. So on the first, they did a soft launch. Sorry, my words are failing me. Soft launch at the YMCA a couple of weeks ago, and they only got 13 kids. They were doing a 20, and so they can't. And I think they've got 4 or 5 sections now. They've divided the gym up into different sections. They're having trouble getting people to come. But if you look at the camps that are outside, those are full, and a lot of times they have waiting lists. So we are seeing some differences between the camps, but a lot of that has to do with whether you're outside or whether you're inside is what we're seeing. Some of the rec departments, we don't necessarily deal directly with them, but we've been trying to help them, and they are setting up against the same criteria that the schools are, the daycares are. So they're trying to be creative and doing tennis and camping and fishing, kayaking. So they're trying to offer outside activities for youth to get them out of the house and get them in to where they need to be. Can you guys still see me?
Yes.
Yeah.
I lost you.
Do you
Okay. You still there?
Hold on, I think so. I apologize. You all went blank on my end. Yeah, so I think that is, and then, trying to do the budget, we have a staff member that's been around for 30 years who's going to take advantage of that early retirement incentive. And so that's going to sort of shift what's happening with our services and how we're providing them. So we're working with our funded agencies and municipalities who are just trying to do the best with all the unanswered questions right now. So that's sort of what we're doing. And just really trying to work with Sue and all the other providers to try to make sure that we're getting information in a way that's timely and is actually helping some of those problems. So
it's great. Thank you, Kate. We appreciate the check-in. Okay, let's see. Kit, do you mind giving an update?
I don't. Hi, everybody.
Right. Hello, Kit.
So let's see what's going on at DSS. We had our face-to-face waiver extended. So we were anticipating on July 8th that we were going to lose our face-to-face waiver from OTDA, which would mean that we would have to start doing in-person meetings with applicants for all the eligibility programs. It got extended through early August. We have heard from the state that they are trying to get more than a 30-day extension, but they're working, they're under pressure because the federal government still has not granted that. And so they have to, it's kind of one of those deals where, we all pass it down the line. They're trying to get approval so that they can give us approval. So we're hopeful. I think it will mean, a big change in our business and the way that we're approaching things. Now we have our child welfare staff that's been going out in person. They have to continue to go out in person. And they've been doing that since the beginning of all of this, as well as our adult protective services staff have been, where they can't change and modify their service. They have been going out face to face with people, but it would be a big difference to have people coming in for service and having to really manage those in-person meetings. So we're hoping that it gets extended. We have our face shields ready to go if we have to go into that face-to-face meeting, and we've got some other precautions that we've put in place. So we'll see where that goes. The other thing I'm really excited about is we have received notice from OTDA that we are going to get our ESG allocation, the CARES Act money that we were hoping, but we had heard kind of back and forth. Yes, you will. No, you won't. We have heard that we are going to be seeing that come to our community. It's about $400,000 that will come to our community. It is, so get excited because it'll do some good things, but don't get too excited because it is very proscripted. We don't have a lot of working room in terms of how we can manage that money. So of course, many people have contacted me and said, I want to do a program, or can we do this with it? And it is pretty prescribed, but I think we are, so we had our first meeting last week. We have to have our application in, even though it's been allocated to our community. In order to access it, we have to turn in an application for it by August 3rd. We have to work, so it's a DSS, Health Department, EOC, COC, the Continuum of Care, and let's see, and also the city. So we all are working together. We had our first meeting last week to kind of talk about where we're going to be our focus areas. A lot of what we're focusing on right now is how to set up some money so that we can support people when the moratorium on evictions goes away, August 20th. That's what we're anticipating. Could get extended, but if it doesn't get extended, we're trying to really put a good chunk of this money in place so that we can support people. We just also last week heard about the HCR, the Homes and Community Renewal money. You may have heard about that New York State has released. It's the rental assistance program. That is a different program and really is there to support families who have had their rental payments interrupted because of COVID-19. So that's going to be there for people as well. That money doesn't come to our community. That's something people apply through a New York State website. They apply for the money and they have to qualify on their own, but it's another huge support for people. So both of those programs are coming. Both of them are, I think, going to be a huge help to people, but we also anticipate with that moratorium on evictions going away, and if the pandemic unemployment benefits don't get extended, or they don't get extended at the same rate that they have been, we anticipate that we're going to see some pretty significant rises in our caseload, and that people, we've already had a lot of people accessing supports through DSS that really have never been people that have needed our support in the past. So we're really looking at how do we put supports in place to help with those things. And then people may hear about pandemic SNAP benefits being issued. That is actually not happening through our office. That's at the state level kind of distribution. You may hear, I'm just saying this so that we stay clear, you may hear people talk about that being integrated with Medicaid. It really isn't. What is happening is that the way the state is issuing them, they're issuing them on existing benefit cards. So in most cases, if the parent holds the SNAP benefit or the SNAP application for the family, the parent's SNAP allocation gets put on the SNAP EBT card. But with kids in the family, if they are receiving Medicaid, they're putting them on a Medicaid EBT card. It's unfortunately, I don't know how the decision got made, but they made that. And so people are calling us and saying, you know, I don't know where, I mean, a lot of times the kids' Medicaid cards are ones that haven't been used in a year. And so they don't know where the card is. So we're having to reissue many, many cards. But there's not much we can do about that, but that's in process. So I just want people to know. So all of that I think is relatively good news. Our caseloads are rising right now. We're seeing that kind of across the board. Our child welfare cases are really, we're seeing this month that they're really starting to spike up there with, I think, what is expected in terms of kids not having the greatest supervision always at home, with people under stress, and not a lot of activities right now. So all of this conversation about daycare is pretty apropos. The last thing I'll say is we did apply and have been receiving through the state now for the last 2 months. We applied for a child care waiver, which has allowed us to, so this is more of a point of interest, it's allowed us to pay for an additional 30 days of absences in daycare programs. So for people who either the daycare is closed or the people weren't putting their kids in care because they lost their jobs or they were going to be home or whatever, we have been able to really extend the amount of absences, both to keep the programs supported, but also to hold spots for families so that families could manage a time when they might not be going to work, and then when they needed to put kids back into care, their slots would still be there. So we applied for that actually way back in May, and we've been carrying that out now, and we will continue to reapply. I don't know how long that'll go, but we are trying to really, keep that going as long as possible to support people. So I think that's it. That's kind of a long list.
Great, thank you, Kit. Any questions for Kit? Okay, I don't see any. Next, Lisa Monroe from Office of Aging.
Hi there.
Hi, Lisa.
Let's see. So we, as far as the functioning of our office, I think JR kind of alluded to that, but we're still doing everything virtually or through the phone. One of our new programs that happens this time of the year is Senior Farmers Market coupon programs. That came out pretty late this year, but so we're trying to be a little bit more creative on how we distribute those coupons, because a lot of the outlets that we would do that with are not happening this year. So we've actually set up outside our office on Tuesdays, Wednesdays, and Thursdays for half the day for people to be able to pick them up without coming in the office. Also working with FoodNet and Cornell Cooperative Extension to distribute them. And we've been in contact with the senior housing property managers that have also helped us get them out there too. So hopefully we can, there's about 800 coupons that we need to get out in a month. So we're hoping to do that. Yeah, and the only other thing, and I don't know if Frank is going to mention anything about that. I saw the press release went out about a positive COVID case in the nursing home, but as far as our limited or our long-term care ombudsman program, we were notified last week that if the nursing homes met certain criteria and they had their plans in order, that we would be able to get back into the nursing homes and do visits. So my staff would be tested weekly, and they will, it would be able to get back in there in person, which is, I think, a big need at this point. Still waiting on some guidance from the ombudsman program. And now, in light of this case, things may also change. The volunteers on the program won't be going back in anytime too soon. So it'll just be my staff. But that's pretty much what we're up to at this point.
Great. Thank you so much, Lisa. And are there any questions for Lisa? I don't see any. And Reverend Ken, would you like to give us an update on the Office of Human Rights?
Sure. Excuse me. Hello, everyone. Excuse me. At the end of June, we sponsored the LGBTQ plus Pride Month panel called Toward Common Ground, Black and White LGBTQ plus folks on collaboration for racial and queer justice. And Shauna served as one of our panelists. She especially gets acknowledgement because she did this while on the road, while returning from out of town. And Ann Corman was another one of our panelists, and Ulysses Smith, who works for gosh, I'm forgetting the name of it. Blend, that is. And they were our three panelists. We were scheduled to have a fourth panelist, Reverend David North, who is a musician and retired pastor and social worker, but he was unable to participate because of his husband's illness. You can see the panel on the county's YouTube page. And we had about 50 people participate in that event. And really appreciative to Dominic Recchio for helping us to, in terms of administering the Zoom panel and posting it on YouTube. OHR also helped to facilitate a discussion between members of the Ithaca Asian American Association and the Workforce Diversity and Inclusion Committee at the end of June. Two members of the Ithaca Asian American Association spoke of personal experiences of discrimination, including a physical assault. And another member provided a larger historical context for understanding the current patterns of Asian American bias that we have seen. And we had a pretty lengthy discussion around these issues. And the IAAA will meet again with WDIC this coming Wednesday to provide some updates related to these incidents and other matters. And thirdly, I have been asked to serve on the county's public safety reinvention process team, and also will be involved with the search for the new Chief Equity and Diversity Officer. I had a couple of interviews with Tompkins Weekly and another with the Cornell Daily Sun regarding that position. I was one of a number of county employees, as well as with Jason, who were interviewed for these articles. So, and in terms of inquiries have been pretty flat, at least this month. We're waiting to get final tallies on what that looks like compared to recent months. So, but otherwise things are moving along for us. And we will also too be bringing back Lourdes Cabrera, the workforce, on a half-time basis starting next Monday. She had been furloughed and will be now coming back and working 20 hours a week for us. So that's it from OHR.
Great. Thank you, Reverend Ken. Any questions? Okay, I don't see any. Now it's time for committee member comments or questions. And I see no hands. If there are no other questions or comments, then I would like to adjourn this meeting. Thank you all for attending and stay healthy and safe.
Thank you,
Thank
Shauna.
you.
Have a great day.
Thank you.
Bye, everyone.